Hello everyone from Luxembourg, and welcome to this EU Datathon 2020 webinar dedicated to COVID-19 and media and data monitoring. First of all, I'm going to introduce myself. My name is Inmaculada Farfán Velasco, and I'm working in the Publications Office of the European Union, more concretely in the EU Open Data Portal, the single point of access to open data from the EU institutions and agencies. So this webinar will be on data and media monitoring in the context of COVID-19 crisis. So here the Joint Research Center of the European Commission will showcase 3 different examples on how they monitor, analyze, and give access to data to support EU institutions and other bodies to tackle this pandemic. So then I'm going to, So in this agenda, we will have in the beginning as a speaker, Guillaume Jacquet from the Joint Research Center, who will present the European Media Monitor and Medicis. So the European Media Monitor helps you to understand, explore, and check current news reported by the world's online media on COVID-19. While Medicis is a media monitoring system providing event-based surveillance to rapidly identify public health threats using information from media reports. Then we will have a presentation from Geraldine Joanny, also from the Joint Research Center, who will present Tools for Innovation Monitoring, or TIMS. That is an interactive tool that allows the user to navigate the data and customize the visualization using filters, showing accumulative values, bar charts, etc. And then to finish, we will have a presentation from Alessandra Nunziato about the European Crisis Management Laboratory. That is a tool that provides an overview of the monitoring in the area of the 34 EU civil protection mechanism, participating states plus Switzerland. But before we start with this presentation, I will guide you very briefly through the website of EU Datathon to highlight all you need to know about the competition. So this is the EU Datathon website. As you can see here, the purpose of the competition is to bring innovative ideas to Europe with open data, according to 4 challenges based on the priority of the European Commission. So, in a nutshell, to take part, you should propose the development of an application that links and uses open datasets, of which at least one from them are from the 1,000 available by the EU institutions, agencies, and bodies. So this is your chance to demonstrate the potential that open data present in today's society, and for sure show your creativity and talent. And it's also your chance to claim your share of the total prize fund of 100,000 euros. So we encourage you as future participants to submit your ideas before the deadline, that is the 3rd of May. And remember that this submission doesn't need to be the application as such, but you need to have give an idea about what you want to develop, the team members, the datasets you want to use, etc. And once you're shortlisted is when you will develop your application or your service until October. For more information, of course, we invite you to go through our website and visit the rules of the competition, where you have all the information you need. So then, since COVID-19 pandemic is affecting in one way or another our current world and the different challenges, we encourage also participants to take this as an opportunity to develop applications and services according to the situation. It's important to mention that the number of the challenges and the rules of the competition will remain unchanged. For more information about how to do this, we created a specific page on COVID-19 that you can see here in the EU Datathon website, where you can have an overview about the existing initiatives, datasets, and visualization from about COVID-19 developed by EU institutions, agencies, etc. So we invite you to go through it, because you can have information also about the webinar that we had from the European Center for Disease Prevention and Control. Having said this, of course, you can have more information by contacting us to our functional mailbox. and also following us on Twitter. So here you have the accounts. So we're here to support you and help you. So I really hope this webinar is useful for you. Please mute your microphones, and you will be able to place your question on the chat box of the WebEx. And then I will place these questions to the speakers at the end of the call, and they will be addressed. So we start with Guillaume Jacquet. So I give you the floor. You can start whenever you want. Give me a second.
Oops. Okay, so let me share the screen. Just a second. Okay, so do you see the presentation?
Yes.
Okay, so let's start. So please feel free to interrupt me if you see that the connection doesn't work well, or if I cannot be here properly. So let's start. So thanks, Inna, for the introduction. And as you said, the idea of this first presentation is to, on one side, present the EMM, Europe Media Monitor, and Medicis, which are both related to media monitoring. And on the other side, to present a new data set that will be released in the coming days, if not hours, related to metadata extracting from textual media. Since I'm the first one and the three presentations are from the JRC, I propose to introduce quickly what is the JRC for people who don't know. So JRC stands for Joint Research Center. It is part of the European Commission, and the idea is to deliver a service related to science and knowledge to the European Commission. So inside, so in Joint Research Center, in few words, we have sites in 6 different locations. We have 3,000 members, so people working for the Joint Research Center. Half of them are researchers, and we have 42 large-scale facilities. So inside this JRC, I am, and actually Geraldine, and the next speaker, is also a member of the Text and Data Mining Unit. So inside the Text and Data Mining Unit, there are 6 different projects, the Tools for Innovation Monitoring that Geraldine will present, and I am a member of the Europe Media Monitor that I will present now. So let's go back to the real presentation. So first part, as I said, is about media monitoring. So just to give an idea of what is EMM, Europe Media Monitor, it's media. So initially it was focusing on political events, but years after years it became broader, and then now it's not topic specific, but trying to identify information related to any kind of topics. So the idea behind is to extract information from text. So the goal is to find knowledge that is hidden in the text by collecting this text, enriching this text, doing some selections, and to present it, to give access to it. So somehow, to simplify, the idea is to make possible the access of for a specific need to 100 most relevant articles when we process daily 300,000. So the source of information we start from are online news sources with different kind of coverage, from local to international coverage, and we try to extract information from them. So somehow the architecture is like this slide describes. We gather per day 300,000 news articles from 70 different languages, from 8,000 different news sources. I think it's even more now. We process this data, we analyze it, and we extract information to finally make them accessible via different applications. Here are mentioned Newsbrief, Medicis. I will give more details about Medicis after, but there are many others applications which are exploiting this metadata to give access to information to end users. So somehow the idea is to reduce the amount of data to be analyzed by experts, to provide additional information, so to extract real new information from the text, and to give access to alerting functionalities for people who really want to know what's happening minutes per minute. So inside this EMM engine, there are many different modules. Each of them is related to, let's say, text mining or natural language processing or clustering. So many different modules, which each of them are extracting a specific kind of information. I will not give the full list here, but I will focus on some of them which are related to the data set I will talk about after. So, for instance, from the text, we extract entities like person names, organization names. We extract quotes, so who said what. We extract locations, and also not only the locations which are mentioned in the text, but also we try to identify, to place where the event happened, the event which is described in the text. We identify sentiment and emotion from the text. We classify the text with some categories. So yeah, more or less the idea is to, from the initial text, so from unstructured data, to convert it into structured data with this metadata I was just talking about. From this metadata, we have different applications, as I said, like maps, customized dashboard, different kind of ways to access this information. We can semi-automatically create reports, which are daily used by inside the European Commission and outside. And just to mention that it's not just a toy tool developed in a research lab and which is used only by ourselves. It's really something which is used daily, as I said, inside the European Commission and outside. And we really have to consider the technical aspect and the reliability aspect when we developed these tools. Just a few words about Medicis, because it is related to COVID-19. So Medicis is somehow an adaptation of EMM for the health topic. So it means that the engine is the same, so we process more or less the same way the information we collect from Medicis, from the news, except that there are some specific categories. There are some specific news sources which are in Medicis, which are not in the EMM, and you have some different applications focusing on trying to, for instance, alert if something is happening in a specific country related to health topic. So here is the new interface, which is not yet online, but will be soon, of Medicis, where you can see the top stories related to health, where it is happening, and some additional metadata. This is an example of reports which are semi-automatically created with Medicis, where actually this is the report created on COVID yesterday. So let's say Medicis is creating a skeleton, and then an expert will finalize this report to publish it. That's the idea, and it is available on the Science Hub. This is called the big screen map, where you can visualize on the map the events on time, like real time. And the last thing I wanted to mention is some additional analysis which have been done based on the data we do have. So here is a study which has been made in 2011 on a specific outbreak, which was the EHEC outbreak, which is a virus. And the graph on the right is showing how from the news you can show how this outbreak was mentioned across countries. So each line corresponds to a country, and it is showing, for instance, that the gray line, which corresponds to Germany, is popping up first before the others. So in Germany, this outbreak was mentioned before. And then you can see weeks after week how it was mentioned in the news. So this, the three last slides, including this one, is showing the kind of output we can create based on the metadata and the analysis we can extract from the news. So maybe it can be useful for the participant of the EU Datathon, as to give an idea of what can be done. The second part of this presentation is, as I said, about giving access to data from the media. So I have to say, for us, it's something quite new. So we are a bit, it's a bit difficult to start this task, because giving access to data is not simple. But more or less the idea is to give access to the metadata we, as EMM and Medicis, created from the news articles, with a focus on COVID-19 and on the period which corresponds to the 4 last months. So the design on the right is showing a bit what if someone will access this data set, he will face a bit the same phase than this guy, like a big piece of rock which contains some relevant information, but there is, I think, some work to do to extract, let's say, nuggets, goals from this big piece of rock. So if we go back to the metadata I was mentioning before, somehow that's the idea of this data set, to give access to this metadata we extracted. But there are some limitations. The first one, and that's the most critical one, is intellectual property. We cannot give access to the full text we collect from the news articles because of intellectual property, and it makes sense. So we spent days, weeks, and actually that's why it's not yet available, but it will be available in the coming days, if not hours. But we really had to make sure that what we deliver is compliant with the intellectual property aspect. The other limitation is the fact that what we will release was not initially made for distribution. So it is something which is for us internally completely crystal clear. We know what is inside, we know why we structured the data like this, and it's fine for us. Now, if someone will look, the people who will look this data set will have sometimes the feeling that it's a bit misorganized, or there are some inconsistency, but the main reason is that it was not made for distribution. Now, because of the COVID crisis, we think that it makes sense to, even if it's not perfect, to give access to this metadata, but be aware that it's not perfect, and also because it's based on algorithms, it can be noisy, so you can find some mistakes in it. So it's incomplete, possibly noisy, but still we think that from this big stone I was talking about in the previous slide, with a bit of mining, you can find gold nuggets. So concretely, if we go back to this slide showing the metadata, in the data set, you will have you will not have the full text, but instead you will have the link to the original article, which might be broken or not, hopefully not broken, but it might be, and 50% of the full article in alphabetic order, with the rule that we cannot make possible the recreation of the initial article from the data we give access to. I hope it's clear. Inma proposed me to mention at this time the fact that additionally to this dataset I'm talking about, there is already on the ODP portal a dataset on entities. So if you're interested on entities, there is already a dataset we make available, which is called GRC names. A few numbers about what we plan to give access to. Just to give an idea, 1 month of our data we will release corresponds to 4.1 million news articles, 76 different languages, 37 million entities, occurrence of entities, 15 million dates, and almost 1 million quotes. So it's quite a lot of data. Even if you don't have the full text, then you still have some data to play with. Concretely, this is how the data will be delivered as RSS items. This corresponds to the information given for one specific article with some metadata I was mentioning. And where will it be available? In the ODP portal. So if you already want some additional information on EMM and Medicis, there are already some pages on ODP describing EMM and Medicis. And we will, as soon as possible, hope, as I said, in the coming days, make at least accessible a teaser of 1 week with exactly the same structure. And in the coming days, the 4 months I was talking about from December 2019 to March 2020. And yeah, that's it. The last thing, feel free to play with these datasets. And most important for us, because that's something new for us to deliver this large amount of data, please give us some feedback if you use it, and if you want to give some comments on this data set, we will be happy to get it. And that's it.
Thank you very much, Guillaume, for your presentation. We have a question actually from the public. Does this tool monitor news article from the Commission too, or just external new resources?
Sorry, I didn't get the question. Does it come from the European Commission? Is that the question, or the sources?
Exactly. What are the sources actually?
The sources. The sources are the one you can access from the web. So if in English you have BBC as an example of source, but many others. And I don't know how many we have for English, but it's something like 1,000 sources, 1,000 different sources. And as I said, so we call.
Hello? I think we lost you. Guillaume?
Hear you.
Okay, now you came back. Sorry.
Sorry, when did it stop?
Like 10 seconds ago. 5.
So no, I was saying the sources are the sources you can access on the web. So it's not European Commission sources, but it's
exactly
much broader. And as I don't know if you heard it, but I was saying that for English language, we have more than 1,000 of different sources. and we cover 76 or more than 70 different languages, and for each language we have a large amount of sources.
Great, thank you very much. I'm sure that once it's published, it will be very useful for the future participants, especially because they can have actually a live RSS feed associated with coronavirus. So this actually makes it very powerful. Great. As soon as it's available, we will of course publish it and promote it, so we make sure everyone can use it. So I think this is the only question we have, but please feel free to write more about this during your presentation and during the rest of the presentation. So thank you, Guillaume, again. Now we go with Geraldine, who is going to present for team analytics.
Hello. I guess you can hear me?
Yes.
Okay, perfect. I'll share screen. Okay, so I'm going to talk about the team analytics project, which you will see it's sort of a sister project of VMM. So a lot of the things are going to sound familiar to you, in particular the data structure we use. So a few of the things are going to be familiar to you after the presentation of Guillaume. So what I'm going to talk about here is research data. So what we are basically referring to is scientific publications and patents data specifically. And this is the data we work with, and I'm going to tell you what have we put in place after this COVID crisis that also has data that can be used by other people. So a little bit about team analytics, what it is and what we do. Basically, it's a suite of IT tools that are used for data analytics, as their name mentioned. Sorry. Okay. So the way we work and the basic framework we have, the way the whole our systems work is that we start with data, and the idea is that we finish with knowledge, and this knowledge is knowledge that should be useful for policy making. This is our main framework. So normally we start here with some data, and this data can come from several data sources. And in our case, and this is very different than with the EMM, we're starting with structured data, and I will say a little bit more about that later. What we do with this data is that we enrich it following several procedures, and I will also tell you a bit more about what is the enrichment we do. And then we put all this data together in what we call an index. This index is what is visible to the user, and then the user can query this index. And what the result it's going to give in our system are different types of visualizations. Okay, and with this visualization, this is what we call that this is the knowledge that we are giving you from this data. So the way we do the enrichment is we work in a processing chain with a bit similar to the one in EMM. So what we do is that this data is going to start in RSS format, and it's going to go through an enrichment chain, and it's going to end up being RSS. It's an enriched RSS. So is what we call RSS plus. So the types of enrichments we're going to do are going to be, for example, we're going to process the text, and we're going to assign automatic keywords. We're also going to do cleaning on the entity names, and this is what we call the entity matcher. We will assign geolocated information. So we will tag a document with a particular city or a particular country. So all this is an enrichment that we do and that you will only find in our index, which is what you query as a user. So our whole system, as I was saying, is a document-based data representation. So basically, we work with documents, and this is, I put you here an example of a scientific publication. This is a document, and this in our system is going to get these several different types of representations that can be. But just for you, so you have an idea that a document is represented with fields and values. It's a bit like what Guillaume was explaining about EMM after the processing they make. So the document itself is going to be transformed into a field and a value, a field and a value. And for example, one of these fields can be a lot of text. So we are going to have one field that contains all this text that is in the abstract of the publication, for example. So any of these fields is what is going to be searchable on the one side, and is also what is going to be used for the visual representations that we do that we show you in our system. So these are some examples of visualizations that we show in the system. So for example, we're going to take the field that contains the organization, and we're going to show you a graph like that. This graph represents all the organizations that are in a certain data set. And we use network graphs because, for example, to look at organizations and to see at who is collaborating with who, this is very useful because the size of the node is going to show you how many documents an organization has. And then the edges are going to show you how many documents in common two organizations have, for example. But you can also apply this type of visualization to any other data you have in the system. So we're going to apply it to countries, where you're going to see which countries have documents in common. We can apply it to things like patent classes if we're working with patents. We can apply it to individual authors and to almost any other data that we might have in the system. We not only do network graphs, we also do other types of visualizations. Here, this is just an example, so you have an idea that we do more than just network graphs, that sometimes they're a bit difficult to understand and a bit scary for some people. But we also have geographical maps and other types of line plots and things like that. So if we go on to more specifically what we've been doing respect of this COVID-19 crisis and what have we been doing in terms of mainly making the research landscape of we've been monitoring what research has already been done on coronaviruses and related diseases. So I'm going to talk mainly about 3 activities we have done. Everything is in our website, and I'm sure we'll be able to circulate the presentation as well. So you will have all the links. Go and check them because there it's better explained than what I will explain now. So you can go and all the information is in there. So first I'm going to talk about a landscape we did of the research activities on coronavirus. This is using a system that is based on Scopus publications, and then the patents from PatStat and Cordis projects. But I will show you in a second. Then I'm also going to talk about the access we are giving to a searchable repository on coronavirus related publications. And this is, it's called the COVID-19 Open Research Dataset. And this is totally searchable by the user. And you will see more about this. And then we're also launching another repository that is more general, is not only about coronavirus research, which is of open access publications in general. And these publications are coming from a platform called Semantic Scholar. And then we also added on top of this the patents from PatStat and the Cordis project. So these are the 3 things I'm gonna talk about to you today. So the first thing is that we used our main tool, which is called Team Technology, to make a landscape of research activities on coronavirus. In this Team Technology, what we have inside is, as I was saying, the Scopus publication, the PatStat patents, and the Cordis projects. This is a tool that is not searchable for external users, so it's mostly not applicable to most of the persons that you are listening, but we can show you the results of the searches we made. So what we did is that we prepared a website where you can access these public searches we made. And this is how it looks like. I hope it changed and you're seeing the tool. So this is our tool. And here you're going to have a lot of already made searches about coronavirus. So basically, there's one on EU projects, there's one on scientific literature, there's one on patents. And there's other things. There are other patent categories that were defined by WIPO that are related to coronavirus that are also in here. Can I get the questions later? Because if I stop now, yes, no?
Don't worry, you can answer later.
Okay. So what we did with this system is we prepared this website where we're already showing you a few of the key messages we saw, by doing this analysis. So for example, we look at what is happening with the number of scientific publications per year. And for example, we were able to see that there were two peaks in time, one that corresponds to the SARS outbreak and that one that corresponds to the MERS outbreak. And we don't see yet the one that corresponds to the coronavirus outbreak. Then we can make a study of which organizations are publishing in Europe and other things. We can see who is applying for patents. And every time, this is the analysis we made, but you can click and then you go directly to the tool and you can go to the data itself and see it by yourself. Well, now it's taking a little bit of time to open, but it opens and it shows. So this is what we call the landscape of research activities. It's not searchable, but you can already consult all this information that we put in there with searches we define. Then we also have, this was just some screenshots from the thing. We're also launching what we call Team Open Access. The difference with this tool is exactly the same tool, basically, but it's pointed at some different data sources. And for scientific publications, in this case, we're pointing to Semantic Scholar. The difference of Semantic Scholar with Scopus is that it's a different database, and it's a database that is open. So we can give access to external users. So in this case, you're going to have basically the same tool, but you can make your own searches. So you can define the way you want coronavirus or something more specific or something else that has nothing to do with coronavirus, if that is your point. On top of this, so this would be this Team Open Access Index, where we have these three databases. We are giving access to this COVID-19 database that I was talking about before. This has been put together by the Allen Institute of Artificial Intelligence. And basically, they've been pooling efforts from different research centers, and they're putting together a repository of more than 50 million publications, I think. They're all open data, and they're all about coronavirus or other related diseases. So this is a specific data set only on coronavirus-related things. And it's completely open and free. What we did is that we know for a lot of people, maybe this is not something easily exploitable. So what we did is that we took this data and we put it inside this Team Open Access system we have. And this is what I'm going to show you now. I think I already said all this, but you have it written. So we have more than 52 million publications. And also, I forgot to say, a big part of it, I think more than 40 millions, are full text. So you're going to be able to make searches also in the full text in there. And another important thing is that the same processing we do in the normal team, we are also going to do here. So if we have somewhere, we're going to enrich it. For example, we are going to extract automatic keywords. Yes, sorry, I've been saying millions all the time, and it's thousands, not millions. I'm a bit too excited. Okay, so the COVID-19 dataset inside team. First, I want to show you a few things. They're already written in the website, but like this, I can tell you in case you want to try. So you need to authenticate using EU login. Anybody can make an EU login. So you will go to our website, you make your EU login, you log in, and then to make a search, you have to select that you want to make a search in this particular data set, and this is the way to select it. And then you have to type a query. So you have to make a search in a similar way that you would do in Scopus or other database. This is the way to make a search. So basically, you need to use terms, operators, and fields. So you need to choose in which field you want to search for the term. And then you can use several things. For example, you can use quotation marks to create a phrase and a few other things. I'm not going to go through all the details because I want to show you, if I still have time, I want to show you a live demo of this. So here I put a few query examples for you to have them, but I'm not gonna go through them right now. So let's hope it works, and I can show you a real search in the system that is already up and running, if everything goes well. Okay, so if you follow the link in the website, you're gonna arrive into a screen like this. And when you start, you're a new user, you're not going to have anything. So you cannot navigate any data because there's no data yet, let's say. So you have to create what we call a new data set. So to create a data set, you can click here. And here I'm going to select this COVID-19 data set. And I decided as an example to do the chloroquine example. I don't know if you've heard at some point, all the media were talking that chloroquine might be a cure for the coronavirus. So we're going to look if in this data set of scientific publications, there are a lot of publications about this or not. So I decided to look in the description of the article, which is basically the abstract of the articles. Maybe if I write it correctly, it's going to work well. So I'm writing description, I'm putting 2 points. We're going to do a very simple search. I'm just going to say, okay, I want the term chloroquine and I want the term coronavirus. Because as I said, this data set might contain some other things that are not only coronavirus. So we're going to add coronavirus. Okay, I create the data set and the system is already telling me that it found 26 results. So we can already see that it's not such a popular thing. We're going to submit the data set, which means now I can go and explore it. So my data set is here. I made a typo, but it doesn't matter. And I can go to dataset info to see what is it that I'm retrieving. So all this is live. I'm not tricking you or anything. So here, what you see is that these are the documents we retrieved. We retrieved 26 documents. You can see when we made the search and a little bit more technical information. You can see when these documents were published. Okay, here's not very interesting because there are very few. But then here we can use these 2 bars here to navigate into several dimensions of the data. So for example, I could be interested in seeing the organizations, on seeing who is publishing on chloroquine and coronavirus. And here I get immediately the graph. Also, it's a very small amount of data, so it's easy, it's fast to compute. But here, in like one single click, I'm seeing all the landscape of research on this. I'm seeing who is working on this, how many, for example, who is the bigger actor. Here, they're all quite small. They all seem to have maybe 1 or 2 publications each. And then we see with these links who is working with who. We could also go to location and see a similar graph for countries that are publishing in this topic. And we see here, for example, China is one of the ones that published the most in here. And then the last thing I wanted to show you, which is also one of the added values of us putting this data set here, is that we generated automatic keywords that were not there. So basically, we have text mining algorithms that are able to extract keywords from the text. So for each of these publications that are in this data set, we're extracting an automatic keyword. So for example, this is the way these keywords look like. You see one of the most prominent ones is coronavirus. We have the chloroquine here, and then we have some other keywords: viral replication, infection, hydroxychloroquine, and things like that, death, tables. I don't know. it might be interesting to explore. So now I lost my example that I wanted to show, of course. But we're going to take this hydroxychloroquine, for example. So I can always filter down using these graphs. So if now I double click on this, now I'm just selecting of all my publications that I had in there, I'm only going to select the ones that have this word, hydroxychloroquine. And now I can navigate somewhere else, for example, to this documents page, and I'm going to see only the documents where this word is found. And here I have the list of 13 documents that are also mentioning this automatic keyword. I can read the abstract, I can see who published, and I can access the publication directly. And because they're open access, in principle, everything should be, they should work without the need of you having any subscription or anything like that. So this is mostly it. There's a lot more that I could show you, but we don't have time. But this is mostly what I wanted to show. I have also, if I come back to my presentation, go to our website and check because there's much more information there. And this is our main support email. So please write to us there and we will make the best to show you more and to guide you a bit on what you can do. And that's it.
Geraldine, thank you very much for your presentation and this great tool. I have to say that once this webinar will be recorded, so then when it's uploaded to the website, we can of course put all the different links and presentation you consider. So we make sure that the users can access there and just go through it. It was really interesting. And we have one question from Maria: is in what formats can we export these results?
We have many formats for you. So you can export a simple Excel from any graph. If you're in a graph of organizations and you just want to have a list of organizations and next to it the number of publications, you can export that very simply. But we also have other more complete formats. So you can export in RSS, you can export in JSON, and then get all the results of your search, let's say, in one bunch. And then do your own processing if that's what you want. Great. And yes, I see in your question you say tabular format. I would say yes, and in text format as well. What about the content itself? It's the metadata. So if it's just metadata, but one of these metadata fields might be the full text if we have the full text.
Really nice. Okay, I think there are no further questions. Thank you very much, Geraldine, again for the presentation. Then to finish, we will go for Alessandro Annunziato, who will present.
Your voice, but I imagine that I have to give my presentation. Can you hear me?
Yes, sorry.
Okay.
I was saying basically that thank you very much, Geraldine, and that we can pass now to Alessandro Annunziato, who will present for European Crisis Management Laboratory.
Okay.
Great.
Thank you. Thank you. This is okay. This is. Can you see the screen?
Yes.
Okay. The objective of this presentation is to show you the activity that we have done on modeling and data analysis, and also the website that is part of this presentation and also part of this Datathon. So for who does not know what the European Crisis Management Laboratory is, this is a laboratory of the Joint Research Center. And we are, let's say, we act as the research, development, and test facility for crisis management solutions. So we develop applications, crisis tools in order to support the crisis management needs. So we perform analysis, situation awareness, and collaboration decision making. One of the major let's say, product that we have done is the Global Disaster Alert and Coordination System. That is a system that analyzes all the major natural disaster events in the world and tries to understand what can be the possible impact of every event on top for the to support the humanitarian community. Our laboratory is also a physical laboratory, so we have a quite large crisis room that is not a real crisis room, but is mimic a crisis room where we test all the applications that then are used in real crisis room. And in the case of the European Commission, the real crisis room is located in Brussels and is in the premises of the of the humanitarian DG, that is the entry point for all the crises in the Commission. In particular, for these COVID cases, we have been involved into these activities since the beginning. We have worked in many fields, from data analysis and modeling also. For data analysis, we were producing situation assessment almost every week. We have produced for our internal hierarchy and various, let's say, internal bodies. We have developed a subnational data repository, and this is mostly the objective of this talk, and also a measure database for modeling purposes. I will talk about this later. In case of modeling, we have worked on heads-up calculation, means calculation that has to really to make understanding what could be the potential risk of this event, but also strategic calculation and real-time online forecast. So in terms of analysis, what you see on the left is a plot that we developed on 13 March. So we were still at the beginning of this emergency when Italy was one of the worst cases, while other countries were following behind. But at that time, it was quite easy, relatively easy to predict what could have been the behavior, because, let's say, it was almost a pure exponential growth. So even with a simple, let's say, regression, it was possible to calculate what could have been the behavior after 3 or 4 days. Today is much more complicated because now we need the real modeling tools, because now it's no longer exponential. There were a lot of interventions done that changes completely the behavior. So you need to have a real modeling tool that can take into account both the epidemiology, but also the intervention measures that have been done in order to contain the emergency. This is still a plot that was done at the beginning, where we wanted to demonstrate that all the countries were following the same line, because at the beginning, many countries were, let's say, at very, very low number of cases, but we were showing since the beginning that every country was almost following the same route that Italy was following. And so we started to develop plots like this that were showing what would have been the behavior if no containment measure was implemented. Taking into account that at the beginning, this was not the case. A lot of countries were not adopting any measure. And so we wanted to show that there could be millions of cases that could have been created. And this was our heads up, because this gave the impression of what could have been the real impact of this event. Plots like this that were showing the behavior after a few weeks of what could have been the disease progression have been very useful in order to, let's say, wake up minds. Then we went to understand better what was the behavior afterwards. In order to do that, we had to go to modeling. So in order to perform a model, we went back to China and we saw what could have been the behavior for China. And so we set up our model in order to almost correctly predict the behavior of the cases in China. In order to do that, we used a quite simple SIR model with no isolation or with the isolation of the cases. And so at the beginning, we were also showing that this plot was done about 15th of March. We were showing that closing one day, closing means performing the lockdown 1 day after or 1 day before was very important because it was counting almost twice the number of cases that could have been done. So it was again demonstration that this was necessary to perform this type of action. Now they've been performed then on 10th of March in the case of Italy. So all this required to store the information into a database because, let's say, we wanted to store and not lose a lot of those information. Take into account that a lot of countries were showing their data in their websites, but for example, many countries, the data were disappearing after 1 day, or they were in a form that could not be, let's say, easily retrieved. So we started setting up a method in order to collect all those data. And now we are collecting data from 29 countries automatically and manually from 17 countries. Why this? Because these 17 countries, we could not find an automatic way in order to take those data. In addition, we are storing data at regional level as much as possible. When the data are available at regional level, we store at regional level. And this is the only database that currently shows on a European scale data at regional level. There are many others, but they are not at such level of detail. And I will demonstrate later why this let's say, level of detail is necessary for the modeling purposes. In addition to the simple, let's say, epidemiologic data, we are also doing a huge amount of work in collecting the restriction measures. Because for modeling purposes, if you want to model correctly the behavior of the pandemic, you have to say that from that time, as I showed before, this particular action was done. So the school was closed, or the shops were closed, or free circulation was impeded, and so on. So what we are doing with the help of several colleagues in our unit, we are collecting the implemented measures by the various countries within a certain taxonomy that we have defined. But as I said, these are very important in order to take into account during the epidemiologic calculations. On the right, there are some details of the website that has been developed. So just to understand about the difficulty to acquire the 46 different countries, every country has different format, has a different taxonomy, and so we had to write a specific program almost for each individual country in order to be able to retrieve them automatically. For the one that we could not, we have developed let's say, a Windows program in order to enter the data manually into our database. So this is the website, and I think that it's better to go directly in the site, and then I come back to the presentation. So this is the website, and let's say you can access the regional cases dashboard, or the maps, or the GitHub. Those are the three parts that are currently available. The other we are developing. So for the regional cases, unfortunately I reduced the resolution in order that you could see. But we have on the left all the list of the countries, of every country of European scale. And on the right, we have a number of widgets that represent the situation. I go to Italy. Okay. So in the case of Italy, you have some, let's say, bar charts that shows what is the distribution of cases within every single region. And you have here some plots, and those plots are regional scale. So for every region, you can identify the cases behavior, or you can click here and you go at country level. If you go at country level, this is the overall for the whole country. And it's interesting that you can also show the current positive, that are the positive cases minus the recovered and minus the fatality cases, or the recovered cases, the fatalities, the hospitalized, and the intensive care. Not all the countries have this level of detail. I showed Italy because it's one of the which that present the data in the best possible way. But a lot of them, they are present with the same level of detail. And what is interesting is that you can also show the variation of those quantities. And this is quite interesting because shows you, for example, the daily variation of the cases, and you can easily see how it is decreasing and where the peak is. Or by closing, for example, leaving only the intensive care, that is one of the most interesting. You can see that the peak of the intensive care was reached on 18th of March, and now we are in a negative phase or positive case. In addition to the countries, we also have European view, so we can show the situation for all the member states. And we can see this for country means for Europe. And we can again see the overall number of cases as variation or as cumulative. So now we see that as an overall, for the whole Europe, we are in a quite stable situation. And this is does not mean, because let's say then you have to see country by country what is the situation. The other interesting part of the site is the one related to the measures that have been implemented. So for every country, you can click here, and you have the list of measures that have been implemented by each country. If it was a school, when they were closed, if they were considered open, and so on. Something that is still missing, and this is something that could be one of the objectives of the research, is to combine those two. So to show at the same time the plots with the cases with the measures that have been introduced. Normally we do this with presentation, but we do not have any, let's say, online system to show that. So I come back to the presentation. Okay, this is the restriction measure database. I show you that you can see. And then we also have a GitHub in order to offer the data. So you can access the data in a simple form, text form, country by country or region by region for every single day, or cumulative for the whole period. So you can take all the data of our database, let's say in a simple, let's say in the simplest way. This is not the only thing that we are doing. We are also trying to develop new modeling tools in order to take into account additional factors. So the objective of all this activity is to build an alerting system for the COVID that can take into account epidemic curve, mobility data, we will come back in a moment, the restriction measure, and to produce alerts based on the estimated behavior for the future once all those systems are calculated and estimated. It is not simple. We are at the beginning for this activity, but let's say we are working on this. For the moment, again, we use the simple SIR model, and with that, today we were able to estimate what will be the behavior in the next future if no measure is released. If some measure is lifted, this behavior will change, and we are working on this in order to estimate what can be the behavior after the reopening of the system. In order to understand well what is happening, we come to use mobility data. So there were the mobility data that were published by Google, by Apple, and the Commission has a particular agreement also with the mobile network operator in order to get mobile data. How we want to use those data? For example, this is the case of Google data, and you can connect, let's say, again, the behavior of the mobility data with the measure implemented. The plot that you see here is not the Google data, but those are the lockdown factor. That is a factor that we invented that allow us to say how much locked is a country. So if you follow the plot, you can see that, for example, when there is a decision by one country, you see an increase of this factor. And those factors, from this factor, we can back estimate the R0, that is the reproduction factor that is used for epidemiologic calculation. And what we have done, we have tried to compare the reproduction factor that we have estimated using those Google data with the reproduction factor that we can estimate from the data themselves. And the agreement is relatively good, given the complexity of the matter, but at least the trend is respected, and the number of countries, both from the epidemiologic data but also from the Google data, seem to respect to be below the reproduction number one. That means containment of the infection. Other are very close, and others are still quite far from it. The last thing I want to show is that we are also going to develop these fact sheets. Fact sheets are, let's say, 2 pages document, PDF document, one for each country, in which, in a quite comprehensive and compact way, we want to show the status of the epidemic. And we do this reporting general numbers from the epidemic and the trend, together with a heat map of where the cases, most of the cases are, with a timeline of the cases in various formats, plus the implemented measures that have been done. So for this Datathon, what we offer is the full availability of this database that you can exploit and find and develop fantastic views that we will include in our website. Thank you.
Alessandro, thank you very much for your presentation. Indeed, I think this will be very powerful as well, because I saw that in so many of the visualizations, you displayed at a national level, but as well as a regional level. That actually it's also one of the in every challenge is coming on the rules of the competition, that we don't only want to show what's happening at the national level, but at the regional. So it's really powerful. Thank you very much. We have a question here. Okay. One question is, do you consider adding a link below each graph pointing to the data behind?
Sorry, what is the question?
Do you consider adding a link below each graph pointing to the data behind?
Yes, it is. It is like this. If you touch the graph, you have the numbers. This is already, because it's done with eye chart, and this is quite standard.
Okay, and
I understood well the question. But...
Yes, I think that was a question. Maybe it was not displayed. What are the sources of this data?
We access as much as possible authoritative sources from health authorities, but in some cases this is not possible, so we try to find as much data as possible to have a complete set. But they are not all authoritative sources. Where they are specifically written. Where they are not, this is indicated.
Great. And then are your resources and methodology documented on the ECML COVID site?
In reality, we don't use any methodology. For the moment, it's only, let's say, collection. In the website, it's only collection of data. Methodology are more for the processing of the data, but this is not part of the website.
Okay, great, thank you. Another thing is the data that you have collected from various sources in order to build your models. Do you provide it too for open use?
Yes, they are all in the GitHub database, in the GitHub site. You can download.
Great. Another question: did you look into data at NUTS 3 level as well?
This would be very nice, but only one country, that is Italy, is offering this. And we store those data, but we do not show in the website because it would be the only country that could show. We are in the process of requesting all member states to offer the data in the same shareable way, but okay, I don't know if we will succeed.
Okay. And then I think that's it. I went more or less through all the questions. Yes. Well, so I think this is the end of the webinar. I want to thank again Alessandro, Guillaume, and Geraldine for your presentations. Indeed, at the beginning of the outbreak, there was like a large amount of information that was produced. So it's really nice to have this tool that facilitates the access to this data and this information. So not only the participants of Datathon, that of course they can use this, but I think in general, citizens or policymakers, they can make use of these really powerful tools you are offering, and they can just analyze information in a more easier way. So thank you very much. We will have this presentation very available in our website very soon. Also, all these tools are published in the EU Open Data Portal. And tomorrow we will have another webinar that is about COVID-19 and air quality, and it's done by the European Environment Agency if you want to join in the afternoon. And having said this, I wish you have a very nice afternoon. Stay safe. We keep in touch. Thank you very much for your